Welcome to Learn with Nana. In this channel, I'll teach you about diagnostics, pathophysiology, respiratory care, and neonatal and pediatric respiratory care. Plus, I'd give you practice questions. To learn more about this, subscribe now, like this video, and comment your thoughts. Now let's proceed. We have learned in my previous video how to interpret ABG in 3 easy steps. If you haven't watched it, I'll put the link below or you can click on the top screen of this video. So for today, we'll be learning about how to interpret ABG when the patient is with oxygen support. But before that, the answer to the ABG result from my previous video is uncompensated metabolic acidosis without hypoxemia. Did you get the right answer? I bet you did. Now let's hop on the next topic. Now we have added another parameter to look at, the FiO2. The FiO2 of a patient without oxygen support is 21%, which means above 21%, the patient is receiving oxygen support. Step 1. Look at the age of the patient. This is the table guidelines to interpret the ABG result of a below 60-year-old patient with oxygen support. As you have noticed, we have used the term corrected, uncorrected, and overcorrected for a patient that is receiving oxygen support. Now let's try some practice questions. This ABG result is an uncompensated respiratory alkalosis. Now let's look at the age of the patient that is 30 years old. Then we'll follow these guidelines. Look at the PaO2. It is 160, which means that is overcorrected hypoxemia. Another practice questions. This ABG result is a partially compensated respiratory acidosis. The age of the patient is 40 years old and the PaO2 is 30. Again, we'll follow the same guidelines. The PaO2 of this ABG result is below 80, which means that is uncorrected hypoxemia. Now, what if the patient is above 60 years old? Let's interpret this. A 60-year-old patient has a normal PaO2 of 80 to 100. Since the patient we have here is 70 years old, we have to subtract 70 minus 60 and it will give you 10. Then, since the lower limit of the PaO2 range is 80, we have to subtract 80 minus 10 and that will give you 70. So, the normal PaO2 of the 70 years old patient is 70 to 100. Therefore, the ABG result of this 70-year-old patient is uncompensated respiratory alkalosis with corrected hypoxemia. Now let's try another one. This patient is 80 years old, so we have to subtract 80 minus 60 and that will give you 20. Then subtract it to the lower limit of the PaO2, which is 80. 80 minus 20 will give you 60. So the normal PaO2 range of a 80-year-old patient is 60 to 100. But before completing the result, we have to look at the FiO2. The FiO2 is 21%, which means the patient is not on oxygen support. So we will be using the table guidelines, the mild, moderate, and the severe. So the ABG result is fully compensated respiratory acidosis with moderate hypoxemia. Remember to use the mild, moderate, severe table guidelines when the patient is not on oxygen support, and use the corrected, overcorrected, and uncorrected table guidelines when the patient is on oxygen support. And always keep in mind the age of the patient. I hope that I have helped you to ace your exam and saves you time in your work. Now I'll leave a practice question for you and comment down your answers. I hope that you subscribe, hit the like button, and share to your classmates to top your class.